So, under this learning objective, you would be able to outline sources and status of legislation, regulation, and guidance, whichever chosen country you've thought of including. You're going to analyze the impacts of legislation and guidance on the provision of health and social care provision and on health and social care workers. And then we're going to talk about how to analyze the aims and purpose of legislation and guidance. And then the last one would be to assess the implications of failure to comply with legislation or guidance. So we talked a bit about the assignment also that you're going to be expected to submit for this unit. And I'll give a thorough session on assignment discussions next week, Sunday. So if we outline the sources and status of legislation, regulation, and guidance in your chosen country, so there are many resources or sources of legislation, regulation, and guidance. And this is particularly for health and social care within the United Kingdom. So for instance, you have legislations on care, which you have the Care Act 2014. You have the Mental Health Act. So in 1848, there was a Public Health Act, which was the first step on the road to improved public health. Then you have the Mental Health Act, you have the Human Rights Act 1998, Equality or the Equality Act 2010, which we talked about a bit yesterday, Health and Safety and Data Protection 1974. Please remember when you're mentioning these legislations and these acts, also mention the years. So there have been several changes in the legislations. So we want the most updated one from you. So you have these in your reading material that we've shared with you and also in the presentations. So when we outline the sources and status of legislation, regulation, and guidance, so what is guidance? There is a guidance always available that's there for health and care of clinicians on how they could conduct different activities, what services are there to be offered, and what provisions can they make in regards to their setting. So this is a set of guidance. So you always would have a set of guidelines that are there for any sector that you're working in, on particularly on health and social care that we are mentioning within your chosen country always. So there's sector guidance, which gives health and social care. There's medical guidance, there's professional guidance, there's code of conduct. So if you adhere to these guidances and these guidelines, it's always best practice. So, but for that, you first and foremost need to know what's available there so that you know you're adhering to best practices or not. So, and then the application of legislation and guidance. So this would allow government departments to put in place the regulations, so wider regulation and guidance. For instance, the WHO, the World Health Organization. So we work, we have several legislations and guidance from the World Health Organization. So it's a specialized agency for the United Nations that's responsible for international public health. So COVID happened. Who was most in action at that time? It was the World Health Organization. The WHO Constitution states that its main objective is the attainment by all peoples of the highest possible level of health. And within health, we have not only physical health, we have mental health as well. So the aims and purposes of legislation, regulation, and guidance should be to protect individuals, to provide them equal access. So if they're using any services, there should be equal access to those services, regardless of their race, of their gender, of their ethnic backgrounds. There will be penalties for non-compliance. So there'll be fines, imprisonment, and loss of licenses. These are also there within regulations and legislation. So this is for both parties. So it could be for the organization and the people who are using the resources of these organizations. If they don't comply, there could be fines and loss of licenses, this particularly for the organizations, the health and social sector we're talking about right now. So what is the sources of guidance? We have government documents, we have professional bodies such as quality checks, we have the GMC, we have clinical bodies such as NICE. So it works for the United Kingdom, and it is an executive non-departmental public body of the Department of Health in England. And this publishes guidelines in 4 areas, basically. So it's clinical practice. So they give guidance on appropriate treatment and care for people with specific diseases, guidance for social care services and users. So whatever guidelines you want to know about, like for, let's say it's for diabetes, or it's for hypertension, or it's for mental health issues, it's for schizophrenia, depression, anything, we have to follow the NICE guidelines because these come through thorough research. They're based on clinical research. Then you have the British Medical Association. So it's a registered trade union for doctors in the United Kingdom. They also give regulations and guidelines. Next, we would analyze the impacts of legislation and guidance on the provision of health and social care provision and on health and social care workers. So what is analysis? It's a detailed examination. So whenever we talk about analyzing, there's a difference between description and analysis. So if you've been asked to only describe, so we'll ask you to describe or to explain or to analyze. So analysis goes one step ahead of description and explanation. So describing is very simple, just describing something that's happened, just a simple description. Explanation goes one step ahead, explains about that description, but analysis then critiques and then talks about different other aspects that may have an impact. So it's a detailed examination of the elements or structure of something. It's more critical writing. So it's the process of breaking a complex topic into substance or substance into smaller parts in order to gain a better understanding. The ultimate objective of an analysis, such as we have data, so when we analyze it, we want to make sense out of that data, isn't it? So that we analyze that data in order to understand it. So consider the benefits, disadvantages, and pass a judgment on your own thoughts. This is why we analyze. So when we analyze, these should be our basic goals. There should be more, but the basic goals should be considering, let's say we're talking about legislation, we're talking about the benefits, the disadvantages, and other judgments that you could have, your own thoughts that you could share on legislation, just giving an example. So the impact on provision and workers within the health and social care. So maintaining safety and quality of provision. The health and safety and welfare of people are always a priority. So a service that's focused on safe care and support is continually looking for ways to be more reliable and to improve the quality and safety of the service that it delivers. So although the provision of care has some associated element of risk of harm to the service user. So when you're providing some medication, let's say, or you're providing a vaccine, let's say, there are some harms to it. But then there's safe care also, which prevents or minimizes unnecessary or potential harm. So there's some harm that you might not be able to predict, but there's harm that you could predict, and then based on your research, obviously, and then you try and minimize that harm. So people will be kept safe and protected from avoidable harm through appropriate care, treatment, and support. That is your ultimate goal. And then when you're talking about following a rule or any legislation, it is very important to keep it consistent. So you're not just doing it for one program, you're not just doing it for one cycle of anything that you've initiated. You're doing it for the rest of all whatever you're involved in. So this means that when you're working on anything, when you're bringing about a change, when you're analyzing something and you're seeing if you want to make a change in something, you have to be consistent. So if you're not consistent, that change that you made so much effort for, that becomes more or less useless. So consistency of care will be low variability in care. So there'll be care that will be constant. So even if you're giving a little bit of care, that should be constant. From shift to shift, day to day, nurse to nurse, resident to resident, attending to attending, and patient to patient. So it doesn't mean that you have a different patient, you would have a different care. No. This high variability, if there is any amongst practitioners, is a major problem throughout the healthcare system. As we mentioned, communities from ethnic minorities get lesser care compared to people who have a majority, which is white people over here, obviously. So this is, according to research, one very major determinant of health, and other provisions also, such as the social determinants of health, are also impacted by these factors. So variability is the lack of consistency or fixed pattern. So there's liability to vary or change in it. So what are the practical aspects, like record keeping requirements? So healthcare professionals, they have a duty to keep up to date with and adhere to relevant legislation, case law, and national and local policies that are relating to information and record keeping. So handwriting, whatever they write, should be readable, legible, and written in black ink to enable legible photocopying or scanning of the documents if it's required. So if it's not black ink, when you're photocopying those documents, it becomes hard to read through them. Records must be accurate and written in such a way that the meaning is very clear. They don't have to ask the clinician again and again, or the practitioner again and again, what's written there. Records must demonstrate a full account of the assessment made and the care planned and provided, and actions taken, including information shared with other health professionals. And all entries in a record must be dated. So whatever is being mentioned there, it should be having a date, accurate time, and it should be signed. Then we analyze the aims and purposes of legislation and guidance. Has anyone got any questions so far? I hope everything is being clear to you. The objective of these face-to-face sessions is definitely, it has to be that you're more interactive in these. So it helps the tutor also to understand that, yes, you've gained what you had to. Okay, so the Department of Health's purpose is to help people live better and longer also. So you're not only helping them living longer, but better also. So there's quality as well as quantity. So the Department of Health lead, shape, and fund health and care in England. So, and they make sure people have the support, care, and treatment that they need with the compassion, respect, and dignity that they deserve. So the main aims and purposes of legislation and guidance are to reduce health inequalities, address equal opportunities for every service user and clinician, to ensure provision is being delivered and it's being safely delivered, to safeguard service users and clinicians from harm, to set a guideline on how services are to be delivered and what can be delivered, different codes of conduct, they're being communicated, and to set guidelines on procedures and steps, basic steps for all the staff. So it could be a staff such as a clinician or a staff such as a cleaner. So everyone has to know that their guidelines are there available on all the procedures. So then there are implications of failure. These come to when you fail to comply with legislation or guidance. So we're talking about the organization within the health and social care setup. So what happens if they fail to adhere? So it is helpful to remember that health and safety compliance directly impacts the ability to achieve almost all the other key objectives, which are from improving staff retention. So, actually, why is health and safety compliance so important? So compliance means when you're adhering to what you have to do. So what we do, we improve staff retention. We don't want staff dropouts. How do we improve staff retention? Anyone? What is there any way to improve staff retention?
The question again, please.
Yeah, so what are the ways of improving staff retention? Any ways that you could let me know of?
I would say staff reward in terms of salary to pay them adequately, and also reward, extra shifts like bank holidays, like the pays can go up, and also to reduce burnouts. That would be to get more staff in shifts to reduce burnout as well.
Yes, thank you. Yeah, so that could be, you think of yourself as a staff member, what would you want? You would want more work-life balance, isn't it? You would want a good salary. Otherwise, you'll go to some other place who's paying you more. So we talked about the minimum wage also. So now we're going beyond that. So just the minimum wage would not do. You need more health, you need safety, you need a good environment where you're working. And what if it's a part-timer and a full-timer? Are they giving you equal amounts of work, which should not be the case? So a part-timer always gets lesser work compared to a full-timer. And then we enhance productivity. This can be, again, done by enhancing training opportunities. You could improve people who you're inducting in your organization. So you need good quality people to improve your productivity of your organization. Reducing overhead or ultimately generating a healthier bottom line, and health and safety compliance, which is essential to sustainable success. So there are many consequences when you don't comply with health and safety requirement. So you could have prosecutions, fines. So the most serious safety breaches are now routinely in the hundreds of thousands of pounds. So the organization just goes down, and obviously there are many people who have to suffer because of it. There could be imprisonment also because of this. So individuals could be imprisoned. So if there's a person who actually goes towards like imposing an imprisonment, like going and filing a case against someone. For instance, there's been maltreatment by any member of the staff, they could go against them. And this could lead to a sentence of up to 6 months in magistrates' council courts to up to 2 years in the Crown courts, which is a serious matter. Loss of reputation because of this, obviously, it ultimately happens that once you get it built up again, it's not going to be that easy because people will see your past reputation. Loss of current or potential staff. So they would leave, obviously, when they know that this organization has this history of being involved in such cases. So they would obviously not want to be part of it. Downtime and loss of productivity. So breaches of certain laws often result in an organization having to cease services until the errors have been rectified. So the Health and Safety Executive, HSE, it's a government agency that's responsible for encouragement, regulation, enforcement of workplace health, safety, and welfare, and for research into occupational risks in GB, Great Britain. So when we assess the implications of failure to comply with legislation or guidance, you have improvement notices also. So you have the HSC that works in order to avoid being non-compliant with the legislation and guidance. So they have expert opinions there, and they can support you or your organization to work through it. Then you have improvement notices. So in simple terms, they're issued when an inspector is of the opinion that a person is not complying with health and safety legislation, or there's an organization that's not complying with it. So they'll give an improvement notice, which is used to ensure that statutory standards for health and safety and welfare are complied with, and will specify the time period for the compliance. So they'll give you a time bracket that within this time, you would have to produce this impact, or these changes are expected from you. Then you have prohibition notices. So improvement is different, prohibition is different. So these prohibition notices deal with more serious type of enforcement notice. So this notice will be served in if an inspector believes that the activities being undertaken involve the risk of serious personal injury. So like an improvement notice, the prohibition notice must clearly specify the defaults that have happened there. And just like an improvement notice, the prohibition notice will obviously work towards improvement, but it will prohibit the continuation of any offending activities until the issues are fully resolved. So the improvement might give a leeway, and they might accept improved service, but the prohibition will lead to a stop of the services until the issues are completely resolved. So what are the impacts of non-compliance? Staff would be updated they should be updated regularly. Facility staff training should be conducted to ensure they follow health and safety procedures and are aware of what these are. This will help to avoid any potential action taken by HSE and the local authority. So that's about it. Today, we've looked at the sources and statuses of legislation, regulation, guidance in your chosen country. We've talked about Great Britain. We've talked about the impacts of legislation and guidance on the provision of health and social care provision and on the health and social care workers, the aims and purposes of legislation and guidance, and the implications of when you fail to comply with legislation. So we've talked about improvement, and we've talked about prohibition. So your references, if you want to go through them, they are here. And that's about it. If you have any questions for me, please let me know. Any questions? Is the session clear to all of you?
Yeah, I've not got any question.
Okay, that's fine. I hope it's clear to you all, and just in line with your, so on Monday, I'm hoping that the first presentation will be uploaded. Just go through it, and also go through the Moodle pages where your assignment has been discussed. And then next week on Sunday, we will have a thorough talk on how would you have to complete your assignment within 2 weeks' time. Is that okay for everyone?
is for me.
Okay. Thank you so much, everyone, for joining in. And if you have any questions, you've got the email where you need to send your questions in, your queries. And yeah, I wish you a good week ahead. Okay, that's it from my side if there's no questions, and take good care.
Yeah. Thank you so much for today's lecture. Have a good weekend yourself.
Yeah, you too.
Bye.
Bye.
Bye.